You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. In today's episode, I'm going to cover a lot of sort of different topics, but about one main topic, and that's the EMR, or the electronic medical record. This has been, a huge nightmare for my patients as well as myself and colleagues, because currently the hospital system that I work in underwent a cyber attack, so all of those systems are down. And I've seen stories in the paper and in the news over the past few years about other health institutions being hit with cyber attacks and ransomware. And it's really a terrible thing because, patients that were scheduled or had care delayed, or they have to change appointments or move appointments, as well as increasing risk of potential harm or injury because you don't have access to these important medical records. It's just a disaster all around. So when we talk about the EMR, it's something that has been talked about a lot. And it was just a few weeks ago, a topic came up on some of our forums about these issues. So let's kind of back up, right? So we back up to years ago, and it was when I trained and when I was in practice. Initially everything was written. I saw my patients, I talked to them, I saw them, and I wrote my notes down, and I created a progress note, or I wrote orders, and all of that went into a chart, and they were transcribed, and that was just kind of the way it was. And there were some big concerns, right? There were concerns because doctors' handwriting was illegible, and sometimes it was hard to understand or decipher, what they meant, and there was always these fear of drug errors because of the way that people would write things. So there were some concerns there, and then a way of capturing, the data if it was written into a chart. If you did studies, people would have to go back manually. So, what happened, and I'm not a huge expert on the EMR. I have plenty of other things to worry about, but it was really the government that came out and brought up this idea of all institutions needed to have an electronic medical record. And what they did was, if they had the date of when it was going into effect, and if you did it 2 years prior, you actually got like a 2% bonus for your Medicare payments. And the year prior, if you instituted it, you got a 1% bonus, and then you had to institute it. And if you didn't institute it the following year, you got a 1% penalty and then a 2% penalty. And I'm not sure if the penalties went up from there. But what happened was, at the same time, insurances, have been driving doctors crazy trying to take care of their patients. So you had doctors that were, hiring more people and more staff and, more people to do authorizations and deal with the insurance companies. And that cut into the overhead at the same time that the insurance companies were paying doctors less and less for services. And now you had this huge, huge expense that you were forced to do. Otherwise, that you would be penalized, by the insurers and Medicare and the government. So places either, bit the bullet and bought. You're talking about hospital institutions that spent hundreds of millions of dollars. Because there was just an article about the lady that created Epic, being worth billions, with a B, billions. And then you had a lot of these smaller, doctors' offices and small groups that just couldn't afford it. So they basically got absorbed by other larger healthcare systems in the area because they were just being bled dry trying to cover just the bills to pay their staff, because it became so tedious, with the insurance companies, and now this added expense of an electronic medical record. Now, in medicine, as far as I can tell, in my experience, it is the only place where technology has made us less efficient. And nowhere else has this been, visible to me in this past week, because, I spent the day in clinic and I had no computer, and I saw my patients, and I talked to them, I examined them, I gave them a plan, and at the end of the note, end of the visit, I wrote a note. And it was amazing because after my last patient, I wrote my last note, and I was out the door. I was done, like in 5 minutes. It's been shown that for every hour of patient care, most healthcare providers spend at least 2 hours extra to do all the clicking and documentation and box and this and that. And the hard part for doctors, and, kind of be nice to your doctors, because I know from a patient's perspective, I hear from many of them, I hate seeing my doctor anymore because I look at his back or I look at her back. My doctor has their face buried in a computer and they're just clicking away as they ask me questions. And it's become a very impersonal relationship where the, healthcare provider, clinician, patient relationship used to be a very intimate relationship where, you looked someone in the eye and, with COVID, we can't shake hands anymore, but, you were able to at least make some sort of contact. And even now, a lot of primary care doctors are just doing everything virtually from home. So, you're looking at a computer screen and they're still, typing away, but the electronic medical record, again, I don't know any doctors personally, and I'm sure there are some that really wanted this. So don't feel that your doctor's at fault for, burying their face. It's just, it's a means to an end. They have to do it to get it done. And it's basically taken away from this doctor-patient relationship. And it's added a lot more time on the back end. And the good news is for a lot of patients that the record is there. So this is the thing that I really wanted to kind of talk to people about is understand what the EMR can do for you and what it can't do, and what are some of the problems with it. So I've had a lot of patients that believe if they go somewhere and there's an electronic medical record, that it's a national medical record. It's not. It's not a universal healthcare database. So if you're at hospital system A and you go to hospital system B, don't tell me that all my meds and all my information's in the computer. Yeah, it is at your other hospital. But at my hospital, I don't have any information. Now, some places, if you're on the same system, sometimes we'll share that information. But again, it becomes up to the hospital to decide we want to share in our platform labs, or we want to share, operative reports or x-ray reports. But there's not a carte blanche. And I don't believe that's right. I think it should be up to the patient. It's your medical record. So if you decided, you know what, I want all of my labs and notes shared with all hospitals because I do see 3 different doctors at 3 different healthcare systems, it should be up to you, and it shouldn't be up to the healthcare system to decide what they share and what they don't share. It's your information. So that's kind of number 1. Number 2, another law came out which basically said that you have access to all your healthcare information. And I think it's a good thing, and I think it's a bad thing. Why? Patients don't understand what they're looking at if you don't have a degree in medicine. And that's a good and a bad thing. But that was the whole idea of having a doctor. So if I ordered labs or ordered a test, you would come back and we could go over the results. But now, a lot of times, patients are getting these results even before the doctor has had a chance to see them. Why? Because they're working. They're seeing other patients. And they're spending 2 hours on the computer for every patient hour that they've done patient care. And they don't see it and respond to it immediately. We've become this culture of, we click a button on Amazon, it's going to be delivered today or first thing tomorrow morning. But, the doctors are looking at that stuff. And, I can't speak for everybody, but for most people, like if I'm looking for something important, like I think someone has a blood clot and I'm doing an ultrasound, like I'm looking out for that ultrasound report, or they're calling me and going, hey, the ultrasound was normal, or there is a blood clot, because I need to act on that. But if you're coming in to get your cholesterol checked for your yearly physical and you got your result back, and patients are freaking out because they haven't heard back from their doctor the second that it became live, it's because your doctor's working and it's not a life-threatening emergency. But also, when labs show up as high or low, there's some fluctuation or variation. And patients I've found have gotten extremely scared and anxious over a lab value that was listed as high or low, but it was 0.01 high or 0.01 low. Or maybe it was 2 points low, but it's been 2 points low since they were 40 years old, and that's stable for them. So a lot of patients have had a lot of anxiety of trying to interpret this data, which in the past would be looked at by your doctor, and they would kind of scrutinize all these subtle little lab values and go, yeah, all your stuff's fine. Everything looks great. Or you know what, your cholesterol is a little high. We should do this or that, or change what you're eating or exercise more, take a pill. But if you can't interpret the data, people are freaking out. So then what do people do? Well, then they send a message, right? Because you can send a message in the portal. And there are a lot of doctors now that are just being inundated. So they had to see a patient, and they had to spend 2 hours for every hour of work to try to do all the data in this data entry system. And now they're getting message after message after message. And, for a doctor on salary, they may have a certain number of patients that they see, and they may have all the time in the world because they're on salary. But for a lot of doctors still, they're what's called productivity based, meaning they get paid for procedures or the patients that they see. And they don't get paid for every message that they respond to. So that is really taxing a lot of doctors because there's this added push of trying to respond to every single message. And at the end of the day, who's making money? The hospital CEOs, they're making more money. The insurance companies are making more money. Your copays, like my copays, keep going up. And the insurance companies keep getting these profits, lowering the reimbursements to the doctors. But yet, because of government laws, we're now taxed with doing more work than ever. I've heard people say that doctors have become the most highly educated and most expensive and highly paid data entry clerks in the entire world, because most of the systems have even taken away the ability to delegate and have a nurse or medical assistant or someone else put that information in. Some places have learned what's called to use scribes. So these are people that have some sort of medical language background, and they can come and basically on the fly, you can tell them and they can put the data in. A lot of places like us go, we've looked at other places. Sure, that's more effective, but no, we're not going to institute that. You're on your own. So you wind up spending a lot of time, doing this data entry stuff. And, I've heard a lot of other people say, hey, hospitals are for profit. I want my records. Great. Now I can print them out. But in the past, I want my records. Okay, now you got to pay for it. Oh, wait a second. You're a healthcare institution. You get paid for all the tests that I have done at your hospital. You get paid for all of the surgeries that I have done at your hospital. You get paid for all of the doctor's visits that I have at your hospital. And now you're going to charge me to give me a copy of my results? I always thought that was absurd. It was just completely absurd. And it was never easy. Every patient I ever talked to, it was like pulling teeth to actually try to get a copy of your medical records. They're yours. Someone should go, yeah, sure, we'll send them out tomorrow, boom, or we'll print them out, you can pick them up this afternoon. But for every patient that I ever dealt with, it was always a hassle if they went to medical records. So that is one benefit, that now you can see it and you can print it out. And this is what I'm going to tell you. This is the important thing, is that I believe that as you get these records, especially if you're being seen at more than one institution, is make a copy of your records and keep a hard copy. Why? Cyber attacks happen. Right? So you get all these records and all these labs and all these notes, and guess what? Boom, they're all gone. They could be gone. Hopefully they come back. Certain institutions I've heard have been able to pay the ransom. Certain institutions have been able to, they had a backup system. Certain institutions may have lost stuff, but you don't know, what that is until down the road. So for me, I had one health scare, I'm getting older. I've been to doctors, and I have a 3-ring binder. So when I go to doctors, or I have a test, or I have a lab, or I have a study, I get a copy of the report, and it goes in this chronologic 3-ring binder, and call me old-fashioned. But this way, if I go to see a specialist for a problem, or if I had to look back at what my labs were at some point, I can pull it up and go, yep, my blood count on this day was here. This is my EKG. This was my, X-ray report or my MRI report. And I have all that stuff. Because it makes, it makes you the controller of your data, especially if you move. I always tell my patients that are moving, I say, hey, let me give you a copy of your implant record. Hopefully you never need another surgery, but if you need a revision on your knee or hip replacement, these are the implant sizes and serial numbers. So if you have a problem, and someone says, what do you got in there? You don't have to say, I don't know, and maybe my doc retired, or the hospital records got purged. You have a copy of that implant record. So this way, if you have a copy of your implants, pacemaker, defibrillator, shoulder replacement, hip replacement, that's really important stuff. Have a copy of your labs, because for us, people were scheduled for surgery and had pre-op labs. Okay, I can't see them now. So if you had printed them out, you could bring them in and go, yeah, these are the labs I did 2 weeks ago. Great, I can look at them, and this way we can verify, otherwise sending you out and having them redone again. So if you kept a running copy. And the other thing, which I think is really important too, is, keeping a very concise summary. I have a lot of patients, when they come in, I still use a written sort of information sheet, because again, a lot of my patients come from outside the institution, and still, they'll write meds, see computer, surgeries, see computer. Okay. but you're not from here. I don't have access to your computer. So what I tell people is, create a document. If you're on the cloud, like Google, you can get a Google document. You can get it on your phone, your tablet, but whatever system that you use. I even have people that just have it on their computer at home and print it out and keep it updated. But go in and, keep a list of your allergies and what symptoms you get. Is it hives? Is it anaphylaxis? What medications you're on and the dose. And if your doctor changes it, go back and change it. What surgeries you've had, when, by who, and where. And this way, when you walk into a doctor's office, you don't have to fill out any of those forms. But if the computer shuts down, computer disappears, hard drive disappears, backup system disappears, at least you go, this is my medical history. I have everything here. I have my hard copy or have it on my phone. And the other thing is, in case of emergency, this is where it's definitely a questionable thing, and I'm not sure if it's the right or wrong thing, but certain places have talked about the idea of having implantable devices. I think it's not a bad thing. Imagine if you had an implantable device that you had control over, right? It doesn't control any part of your body, but just a little chip that would have your name, emergency contact information, allergies. Let's say you do have an anaphylactic reaction to a medication. Let's say you're diabetic. Maybe you have a seizure disorder. Maybe you're on a blood thinner and, you've fallen and someone's trying to figure out. People always say, well, it's on my phone. Well, great. What if you were ejected from a car in a car accident? Who knows where your phone went, but they found you. They found the body. They take you to a hospital and you're unconscious. How do they figure out who you are or what you are? So with that little bit of information that you would control, they could scan it and they could go, oh, this is who it is. This is the contact information. Oh, you know what? Actually, they're on a blood thinner. They hit their head. They may have a bleed in their head. Or you know what? They're unconscious. They're a diabetic. Maybe their blood sugar's low. We got to check their blood sugar. So for certain people with certain conditions, I think having a little implantable chip, would be a very important thing, and it becomes sort of your self-contained, electronic medical record. But then you would need hospitals that would have to have ways of reading that. So for us, if it was attached to the system, we couldn't use that. So you'd have to have a, separate, isolated standing device. But again, the benefit of the EMRs has really been, and they've touted it to hospitals, is a billing system and a data collection system. So all of this data for you is there. But at the end of the day, it hasn't made, of all the doctors I know, any of our lives any easier. So it's the only sort of positive in all of this that I'm seeing right now is I have a little bit more time because I see my patients, I can look at them, I can talk to them, I can write a note with a pen, and at some point it's going to get scanned into some system, but I'm not clicking away ad nauseum. Prescription writing is actually easier. But this does mean that you need to go to a pharmacy with my prescription, drop it off, and then come back later versus it being digitally sent and then just picking it up, which makes one trip as opposed to now patients are making 2 trips. But at the end of the day, your information is your record. And if it's not a pressing issue for the sanity of your doctor, but also for your sanity, is don't overthink it. I would like to believe that most doctors are going to be looking, and if something is pressing, emergent, abnormal, grossly, they're going to call you with the result. But for these little minor changes, I think the best thing is if you do have access, it's great. Print it out, make an appointment, come in and see your doctor. They can review it, and most of the time they'll let you know, this is normal, this is okay. That little high-low is within normal limits for you. These are the changes that we're going to make to your health history or your medications. And keep a list, make a hard copy, create a document. If you haven't already, create it today, save it on your phone, save it on your tablet of just the important things: allergies, medications, past surgeries, implantable devices like pacemakers. It's very good to know like what company made it, defibrillator, what company made it, implants if you haven't. I always tell my patients, go back and get the copy of the records, at least know the system and the company so you can put that information in there and then print those out when you go and see a new provider at a new institution, because you'll make your life easier and their life easier if you just give them a piece of paper. I always love seeing it when it's nice and concisely written. And then you can update it so you're always aware of what you're on and what's going on. So a lot of information, electronic medical records, kind of the good, the bad, the ugly. Unfortunately, I think most people, including me, are of the understanding that they're here to stay. But I'm really looking forward to tech companies, the places like Amazon and Google and Microsoft that are realizing, hey, we're so big and we have enough smart people and enough technology that, we could create our own health system, health network, health algorithm, And I'm really hoping that they can come in and make a system that is better, that is more useful, that is more intuitive, that is more time efficient, that is more cost effective, and that's more accessible for both people that work in the healthcare field as well as patients, and really kind of shut down some of these other companies, that have taken over this market and made billions and billions of dollars, but have really kind of put out a product that is, fair at best. So control your information. It's yours. Thanks for listening. I'm Adam Rosen. You've been listening to Your Knee, Your Health. Until next time, stay safe. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.